Hello everyone, welcome back. We are talking about the vascular development in the cardiovascular system, and now the topic is venous system. Venous system corresponds to the arterial system. We'll be talking about the vitelline vein, the umbilical vein, and the cardinal veins. So, let's talk about how these veins develop. So, fifth week of embryological life is there. The veins are carrying blood. These are the vitelline veins. These are carrying blood from the yolk sac to the sinus venosus. So the umbilical veins originating in the chorionic villi and carrying oxygenated blood to the embryo. These are the umbilical veins in white. These are carrying oxygenated blood to the embryo. The cardinal veins, these are the cardinal veins. They are draining the body of the embryo proper. So before getting into any further detail, this diagram, we need to talk about this. This diagram is a simplified version, a hand-drawn version of what is happening in the embryo during this period of development. You must understand it's a simplified diagram, a schematic diagram, not a true actual diagram or electromicrograph. So things have been simplified so that you can understand easily. I'll explain it to you. This is the cranial end. This is the caudal end. This is the notochord being developed, the spinal cord. This upper portion is the pharynx. And hence, all the diagram has been marked accordingly. This is the caudal end of the diagram. We'll see smaller segments of the diagram and we'll keep on talking about them so that you can easily understand what is going on. So the vitelline vein, so here you can see this is the left vitelline vein, this one is the left vitelline vein. It enters the sinus venosus. This is the sinus venosus. So how does it end? Before entering, it forms a plexus around the duodenum. So the duodenum is not clearly shown here. This is the section of the liver, and here lies the duodenum. So in the section of the duodenum, it forms a plexus. So you have to keep up with me to understand what is actually going on here. So before entering the sinus venosus, the left vitelline vein, it forms a plexus around the duodenum. Now it passes through the septum transversum. Liver cords growing into the septum may disturb the course of the vein. Obviously, liver cords are fibrous structures that are growing into the septum. Since the vein is moving through the septum transversum, the liver cords may alter its pathway. They form the hepatic sinusoidal network. So this is how the hepatic sinusoidal network is formed, with the help of the liver cords growing into the septum and the vein passing through, the vitelline vein passing through the septum. So the left sinus horn is the left horn of the sinus venosus is now reduced. The blood from the left side of the liver is channeled to the right. So there's channeling of blood from the left side to the right side. This enlarges the right vitelline vein. So the right vitelline vein, obviously, since there's channeling of blood, more blood would be flowing through the right vitelline vein. So the right vitelline vein now enlarges or enhances. It is known as the hepatocardiac channel because it carries blood from the liver to the heart. Alright. So now the left sinus horn is reduced. The blood from the left side of the liver is channeled to the right because of reduction of the left sinus horn. When it is channeled to the right, there is more blood flowing through the right vitelline vein, and hence it is known as the hepatocardiac channel. So the right hepatocardiac channel forms a hepatocardiac portion of the inferior vena cava. So this in turn would give rise to the hepatocardiac portion of the inferior. This is the developing inferior vena cava, and this right hepatocardiac channel is responsible for the formation of the hepatocardiac segment of the inferior vena cava. I hope it was something you understood. If not, I'll recap it. So the vitelline vein, it goes to the sinus venosus, all right? Before going to the sinus venosus, it forms a plexus around the duodenum. Now, after forming the plexus, it passes through the septum transversum. Now, liver cords are also being developed within the septum transversum. These developing liver cords now encroach on the may disturb the pathway of the this vitelline vein. Now, this is how the sinus or the hepatic sinusoids are being formed. Now, with development, we know that the right horn of the left horn of the sinus venosus, it is reduced. After the reduction of the left horn of the sinus venosus, blood in the liver is shunted from left to the right side. When the blood is shunted to the right side, the blood flow in the right vitelline vein increases. Hence, it becomes the right hepatocardiac channel. The right hepatocardiac channel then forms the hepatocardiac region of the inferior vena cava. Alright, moving on. The proximal part of the vitelline vein disappears. It was not important initially either, and now it disappears because it is not performing any function. So the anastomosis channel around the duodenum, it develops into the portal vein. Very important. What does it form? The anastomotic channel of the left vitelline vein, which was around this duodenum, it develops into the portal vein. Now the superior mesenteric vein, which drains the primary intestinal loops. So superior mesenteric vein corresponds to superior mesenteric artery, and it drains the foregut. It is derived from the right vitelline vein. The distal portion of the left vitelline vein also disappears. So this was all about the vitelline veins. Moving on to the umbilical veins. So this is the right umbilical vein. This is the left umbilical vein. So let's see what happens with these. Initially, they pass on each side of the liver, but they stay connected to the hepatic sinusoids. So this is the section of this is the region where the liver is formed. So they pass on each side of the liver, but they stay connected to the hepatic sinusoids. The proximal parts of both the umbilical veins, they disappear. The proximal parts, they disappear, not being used. The left vein is the only vein that carries blood from placenta to the liver. So the left umbilical vein, here you can see it is the only vein that is responsible for carrying blood from the placenta to the liver. With increased placental flow, a direct channel is formed between the left umbilical vein and the right hepatocardiac channel, which is known as the ductus venosus. So this is the ductus venosus. Obviously, since left umbilical vein is the only vein that is carrying blood from the umbilicus to the liver, and the right vitelline vein is the only vein that is carrying blood from the liver to the sinus venosus. So a direct channel is formed between the two, and this channel is known as the ductus venosus. Now, the ductus venosus bypasses the hepatic sinusoidal system. So, this ductus venosus, it bypasses the hepatic sinusoids and it goes directly to the heart. After birth, the left umbilical vein and the ductus venosus are obliterated, since placenta is no longer there and there is no need to bypass the liver anymore. So both of them, the left umbilical vein and the ductus venosus, are obliterated. The umbilical vein forms the ligamentum teres. So the ligamentum teres is the remnant of the umbilical vein, and ductus venosus forms the ligamentum venosum. So now let's talk about the cardinal veins. So cardinal veins are the veins that drain the embryo proper. There are two types of cardinal veins, the anterior cardinal vein and the posterior cardinal vein. Both of them join to form the common cardinal veins. Alright, let's talk about them in a little detail. So initially, they are the main venous drainage of the embryo. The anterior cardinal vein, it drains the cephalic part of the embryo, this cephalic part of the embryo. The posterior cardinal vein, that drains the rest of the embryo. It is formed by the combination of short common cardinal vein before entering the sinus horn. This posterior and anterior cardinal vein, they join together to form a small common cardinal vein before they enter the sinus horn. So now, During the 4th week of development, the cardinal veins form a systematic system here, or a symmetric system. So anterior cardinal vein, since it has a small area, it drains the cranial part, so it remains so. However, the caudal portion, or the posterior cardinal vein, which is draining the caudal portion of the body, it divides into further subsections. During 5th to 7th week of development, various additional veins are formed. These veins take over the function of the posterior cardinal veins. As I have told you earlier, the posterior cardinal veins is replaced by veins in every specific region. So the subcardinal veins are formed. These are the subcardinal veins. They are responsible for draining the kidneys. The sacrocardinal veins, these are the sacrocardinal veins, are responsible for draining the lower extremities. And the supracardinal veins, they drain the body wall with the help of the intercostal veins. So the vena cava system. Here you can see this is a simplified diagram of the vena cava, of the inferior vena cava. So we'll see how the vena cava system is formed. So it is characterized by the appearance of anastomosis between the left and the right venous regions. So initially there are left and right venous components of the body, then they merge together to form the vena cava system. So blood is channeled from the left to the right side. Obviously vena cava is present on the right side, so all the blood in the body is channeled from the left to the right side. So there's anastomosis between the anterior cardinal veins. Anterior cardinal veins were supplying the cephalic portion of the embryo, and they form the left brachiocephalic vein. So the left brachiocephalic vein is formed by the union of anterior cardinal veins on both the sides. Okay, now the terminal portion of the left posterior cardinal veins, they form the left superior intercostal veins. So it's just a fact, the terminal portion of left posterior cardinal veins, it forms left superior intercostal veins. So in this diagram, we'll see how the venous system is formed throughout the body. Here you can see the internal and the external jugular veins, the subclavian, the highest left intercostal, the right innominate, also known as the brachiocephalic trunk, the superior vena cava, the azygous vein, the accessory hemiazygous, the hemiazygous, and the inferior vena cava. Okay, let's talk about how they are actually formed. Now the left superior intercostal vein receives blood from second and third intercostal spaces. So the second and third intercostal spaces, they drain into left superior intercostal vein, the right common cardinal vein, and the proximal portion of the right anterior cardinal vein form the superior vena cava. Now the superior vena cava lies in the superior region. We have the anterior cardinal vein in that region and the common cardinal vein in that region. So it's obvious that so the superior vena cava is being formed by the proximal portion of the right anterior cardinal vein and the right common cardinal vein. This is the portion of the superior vena cava. So moving on, we have the anterior cardinal veins which form the internal jugular vein. So here you can see this is the internal jugular vein, and this is formed by the anterior cardinal veins coming together. The external jugular vein is formed by the venous plexus of the face. External jugular vein, this one is the external jugular vein, and it is formed by the venous plexus of the face. Now, there is anastomosis between the subcardinal veins to form the left renal vein. So this is the left renal vein. Subcardinal veins were the veins that were responsible for draining of the renal portion of the human embryo, and hence they anastomose to form the left renal vein. The left subcardinal vein disappears and only distal portion of it remains as left gonadal vein. So this left internal spermatic vein or left gonadal vein is formed by the left subcardinal vein, which usually disappears, and the only portion that remains is this gonadal vein. So the right subcardinal vein, this is the region of the right subcardinal vein, it becomes the main drainage channel and forms the renal segment of the inferior vena cava. So the renal segment of the inferior vena cava is formed by the right subcardinal vein. The hepatocardiac section was formed by the left vitelline vein, or by the right vitelline vein. Now the right subcardinal vein forms the renal section of the inferior vena cava. Now, moving on, there's anastomosis between the sacrocardiac cardinal veins to form the left common iliac vein. Now, this is the left common iliac vein. There's anastomosis between the sacrocardinal veins, which were responsible for draining the lower limbs, and they form the left common iliac vein. The right sacrocardinal vein, this region, it becomes the sacrocardinal segment of the inferior vena cava. So now the renal segment, this is the renal segment. It now connects with the prerenal part or the hepatic segment, which originated from the right vitelline vein. Now the inferior vena cava consists of a hepatic portion, which was made up of right vitelline vein, a renal segment which was made up of right subcardinal vein, and a sacrocardinal segment which was made up of right sacrocardinal vein. So now what is the function of azygous and hemiazygous veins, and how do they develop? So 4 to 11th intercostal vein, they drain into intercostal veins, they now drain into the right supracardinal veins. So along these veins, along with a portion of the posterior cardinal vein, now form the azygous vein. This is the azygous vein. Here you can see 4 to 11th intercostal vein, these small tributaries that are contributing to this. These are the 4 to 11. These are the intercostal veins. These are being formed. And along with a portion of the posterior cardinal vein, they form the azygous vein. On the left, this 4 to 11th intercostal veins drain onto the left supracardinal veins. Now they form the hemiazygous vein. This is the hemiazygous vein, which finally drains into the azygous vein, and then finally into the superior vena cava. So this was all about the development of the venous system of the heart. In this section, we talked about the vitelline veins, umbilical veins, and the cardinal veins. We saw how the vena cava system developed and what were the functions of the azygous and the hemiazygous veins. I know it was a little complicated, but it's very easy. Try to understand the normal so that you can understand the abnormality easier. For further details, keep watching sqadia.com.